Welcome everyone to the module on demand generation and communication framework for action. So for this second module, we aim to, number one, explain the purpose and importance of demand generation interventions. And number two, to help communicators understand the roles and responsibilities of non-healthcare frontliners and our community champions in the COVID-19 vaccination program. So when we introduce our COVID-19 vaccines, both our planners and our frontline health workers must take into account the following challenges, which need to be addressed by our interventions for demand generation and communications. So for supply and priority, we need to earn the people's trust by being transparent with the process of prioritization and the vaccine rollout. So while we want to provide the vaccines for all eligible Filipinos, these will not all arrive at the same time. And this arrival and deployment in phases highlights the need to communicate the goals of prioritization and the considerations for rollout, including storage and deployment. For understanding our target population, so unlike our previous vaccination programs which target children, the COVID-19 vaccine involves adults. And our adults may have preconceived ideas and beliefs about their own health. So these may affect the established strategies and activities and may not be as efficient and effective in motivating the adults to get the vaccines. Hence, our strategies need to be recalibrated for this specific target population. We also have to manage and set realistic expectations on the vaccine's impact. So while there is a need to communicate the importance and effectiveness of vaccines, we have to acknowledge that there are limitations and uncertainties to what the vaccine can do. And as earlier mentioned, the vaccine is just an added tool for protection. And even after vaccination, we need to clearly communicate the continued practice of our BIDA behavior. So yan po yung ating pagsuot ng mask, ng face shield, paghuhugas ng kamay, pagdistansya ng 1 metro. And the continued practice of these behaviors is our surest way to protect ourselves and our families. We also need to manage the huge amount of information available. Mostly online po ito, about COVID-19 vaccines. So the experience of other vaccines who have already rolled out their vaccine plans may influence the perceptions about our country's own vaccine deployment. In relation to this, there is a proliferation. So dumadami po ang ating fake news and misinformation about COVID-19 vaccines. And these fake news and conflicting information affect people's attitudes, motivations, and intention to accept the vaccine. And this may drive people to practice behaviors that are harmful or are not recommended by our health providers. The conduct of the World Health Organization's vaccine solidarity trials or our clinical trials may coincide with the deployment of vaccines that have been given emergency use authorization by the Philippine FDA. So people may be confused about these two things, the clinical trials and the vaccine deployment plan. Because they will be receiving on one hand, the approved vaccine from Philippine FDA, and for the clinical trials, a vaccine or placebo. And lastly, there may be low trust or hesitancy to receive a new vaccine because of previous experience. So negative publicity from the Dengvaxia scandal, as well as the current government's COVID-19 response. So we need to communicate that the national government and local governments, our private sector, and our development partners are conducting all necessary preparations to make the COVID-19 vaccine deployment safe for everyone. So when we talk about the vaccination positions, it's not just actually a yes or a no. So there is a range of positions from the activist who is against it to an advocate who supports the vaccination. So we can actually encourage the movement of positions from activist to advocate by doing the action points. So for example, for an activist, we want to minimize the impact. For those whose position is rejecting, we want to maintain trust. Those who are hesitant, we address their concerns. And those who are accepting, we maintain good consent processes. Those who are demanding, we manage the expectations. And ultimately, for those who are currently advocating, we support their advocacy. And this is what we envision for the vaccination process per phase. So for the pre-vaccination phase, that's on the top left, we want Filipinos to be number one, willing to get vaccinated. Second, we want them to advocate for COVID-19 vaccination and recommend it to others. And third, for Filipinos to continue to practice the minimum public health standards. Below, so at the bottom, is your vaccination phase. So during this phase, we want them to show up on site on the day of their schedule. We want them to continue to advocate for COVID-19 vaccination. We want them to return to complete their dose and to continue to practice the minimum public health standards. And finally, on the third phase, post-vaccination, we want our vaccinees to report side effects kung meron man po silang naramdaman to any healthcare worker. So kailangan po sa healthcare worker tayo magpunta. Also, vaccinees to be able to do home remedies for non-life-threatening adverse effects. And third, to continue to practice the minimum public health standards. So how do we actually do all of these things? No? So we want Filipinos to be motivated to get the vaccine for themselves. That's the first. Number two, and to be able to recommend it to other people. So we all know that motivation does not necessarily translate to the desired action. So what can we do? So we will do this by addressing two things. The first one, motivation is affected by what people think and feel, and also by the social processes around them. So these are your two think boxes. So through our demand generation activities, we should address concerns on these two things, what people think and feel, and social processes. Some of these concerns involve confidence in the vaccine benefits, the vaccine safety, a person's perception of risk, as well as recruiting support for the vaccination processes so that Filipinos will get the desired motivation for these two things. Also in green, practical issues on access and deployment are important so that when we have raised and gotten the desired motivation, it will be easy for the person to act on that motivation and get and do the actual behavior of getting vaccinated. And number two, recommending the vaccination for other people. So we will do this through the coordination and support of all the different stakeholders to protect the Filipinos from COVID-19 through the COVID-19 vaccine. So our stakeholders will involve the national government agencies, our local government units, the private sector, civil society organizations, and development partners. So all of these stakeholders hopefully will be involved in two things. So you can see, meron po tayong green line sa gitna ng slide. Above the line activities include our usual communication efforts. So yan po yung ating mga social media presence, materials, videos, as well as our print and broadcast materials. But we will do all of those things. But also equally important, are our below the line activities. So ito po yung ating mga community engagements like town hall sessions, presence during events like the registration or sign up, and during the launch of the actual vaccination sites. So our communication plan to be able to do all of these things will be guided by these principles. So we want to be transparent and proactive. So we will communicate what we know and also what we don't know, because evidence and the science is continuously evolving. Also, we want to be iterative, meaning we want to respond to the changing needs of our constituents on the ground. So our plans have to be able to recalibrate and adapt according to these needs. Third, we want to be timely, coordinated, consistent, and contextualized, meaning we develop trust and credibility if we are able to consistently provide and communicate accurate information. Number four, we want to be data and evidence driven. So we will use our data and from our listening tools to inform our plans. Fifth, partnership oriented and enabling. So we cannot do this alone. So we need the help of everyone from national, local, regional, private, public sector, and development partners help. So all of these efforts should be synergistic. And lastly, we want to be empowering and engaging. So the success will ultimately depend on the uptake and adoption of the vaccine. So if we make our communities feel that they are listened to, na napapakinggan yung kanilang mga nararamdaman at nakaka-responde tayo no dito sa mga pangangailangang pinaparating nila sa atin, mabubuo natin yung tiwala ng tao. At yung tiwala pong yun ang magdidictate kung magpapabakuna sila. So our communication plan has the following general objectives. We want the Filipinos to understand and feel confident in our approach to roll out the COVID-19 vaccines. We want to maintain trust and demand for vaccine and routine immunization. Understand the importance of physical and mental resilience and the continued practice of our preventive health behaviors or our BIDA behaviors. And fourth, to rely on government platforms as the authoritative and accurate source of information on COVID-19 vaccines deployment. So specifically, we want adults, caregivers, and parents to understand the threat of COVID-19 and the need for herd immunity to protect their families. Second, that eligible Filipinos will be aware of the COVID-19 deployment plan and implementation plan. And third, for Filipinos to understand the difference of the COVID-19 vaccine clinical trials and the government-led rollout of the COVID-19 vaccines. Fourth, that health workers, community volunteers, and other frontline workers can communicate key messages of the campaign and respond adequately. And fifth, for private sector, civil society organizations, local chief executives, and other stakeholders to be engaged as champions for the immunization activities. And to be able to accomplish these goals of our communication plan, we employ the four following strategies. The first is we ensure that unified and science-led messaging. So how do we do this? So across the public and private sectors, we have aligned the campaigns, the BIDA Plus campaign and the Ingat Angat campaign of our private sector. For our national and local governments, we will be providing talk points for the COVID-19 vaccine deployment. And among experts, we want to build consensus on the evidence. The second is we want to multiply champions. Ang ating champions po, if we get their trust, we are transparent to them, they will recommend the vaccine to others in the community. So primarily, this includes our healthcare workers and our experts and scientists, but also kasama po kayo dito sa ating mga champions, ang ating mga local government units. Third is we want to listen and monitor then recalibrate our plans based on the data that we generate through our social listening tools. So these tools will be discussed later. And lastly, we want to be able to respond quickly through organized crisis communication. So just to show everyone, this is the governance structure of the COVID-19 vaccine cluster under the IATF. So the vaccine cluster has 6 task groups, and our task group on demand generation and communications is led by the Presidential Communications Operations Office through the Philippine Information Agency. And its members include us, the DOH, and the NTC. And part of this governance structure is the establishment of COVID-19 vaccination operation centers, or our VOCs. So they will be established at the national, at the regional, and the local levels to be able to do these things. So planning, campaign management, finance, cold chain and logistics, coordination, vaccine safety surveillance and response, as well as demand generation and communication. So I'd like to emphasize na equally important po itong magiging role natin as communicators in the overall success of the VOCs and the vaccine deployment plan. So how do we delineate our roles? No? For messaging, the national level, we will craft the key messages. This will already be provided in the communication plan that will be shared with the group. At the regional level, they may customize if necessary, so that at the local level, they will just need to use and disseminate the messages. For our champions at the national level, we develop the modules and materials and engage national bodies. At the regional level, they will monitor the activities and engage other regional stakeholders. At the local level, they can engage the local bodies that will conduct the advocacy activities and other community engagement activities. For recalibration, we will be developing the tools and do the analysis at the national level. At the regional level, they may use the listening tools and use our local government unit playbook, so that at the local level, they will just implement the tools and use the LGU playbook. For overall response, we will coordinate the COVID-19 vaccine response following protocols that are done by the other task groups. So this is a sample of our key messages according to the phases of the COVID-19 vaccine deployment. So we have a message bank, and for the pre-rollout phase, our messages focuses on 4 main themes: the benefits of the vaccine and urgency of deployment. Number 2, prioritization and timing. Number 3, the rigorous process of development, approval, and monitoring. And 4th, global cooperation. For deployment phase, 2 main themes: patient responsibility and follow-through, and legitimate sources of vaccines and reliable vaccination posts. And lastly, post-deployment phase, we will reinforce continuous monitoring and cultivate a sense of community among Filipinos. So this is a sample message on the benefits of vaccine and urgency of deployment. So we have 2 supporting messages followed by an action point, call to action, which is number 3. So first, that the pandemic has devastated the economy and put a strain on our health system. That second, vaccines will be a valuable addition to our existing tools against COVID-19. And our call to action is that individuals must continue taking steps to protect themselves and other people. The practice of the behaviors will be our continued protection from COVID-19. So ito po yung format natin for our key messages that are available in the communication plan. So as a quick summary, what is your role, our community champions, and social mobilizers in our COVID-19 vaccine demand generation. First is be the champions for COVID-19. As early recipients of the vaccine, as vaccinators, and as the most trusted source of accurate information in community. So we ask you to share adequate and accurate information with the eligible population and other members of our communities. Monitor and respond to questions, issues, and concerns with empathy to increase the trust and confidence in COVID-19 vaccination. Also, we are asking your help to help us monitor and respond to rumors and misinformation. And lastly, to facilitate awareness raising activities and community dialogues according to the microplans. So alam po namin meron ng mga naka-attend at nakapag-cascade ng trainings for microplanning. So kasama po sa microplan natin itong ating demand generation. So ang next question natin, how do we engage with our champions and how do we communicate with the eligible population? So our next module will provide a step-by-step guide for this. Thank you very much.
Tara, sa Vida Vaccination!